The spread of Zika virus has been concerning and scary for some, especially pregnant women. At CDC, we're working around the clock to protect your health and learn more about Zika. Since Zika was first reported in Brazil in May 2015, it has spread across many countries and territories in the Western Hemisphere, including in small areas of Florida and Texas. Zika mainly spreads to people through the bite of an infected Aedes aegypti or Aedes albopictus mosquito. The mosquitoes that spread Zika can be found in many areas of the continental United States, primarily in the Southeast and Gulf Coast regions. These mosquitoes live indoors and outdoors and typically lay eggs near standing water, in things like buckets or flower pots. Mosquitoes become infected when they bite a person already infected with the virus. Infected mosquitoes can spread the virus when they bite other people. Most people infected with Zika virus won't get sick. For those who do have symptoms, Zika usually causes mild illness. Symptoms include fever, rash, joint pain, and red eyes, and typically last a few days to a week. However, the virus can linger in semen for months, and a person with Zika can pass the virus to his or her partner through sex. A pregnant woman can also pass the virus to her fetus during pregnancy or around the time of birth. If that happens, the results can be devastating. Zika can cause severe fetal brain defects, including microcephaly, a condition that is a sign of incomplete brain development. There's a lot we still don't know about the effects of Zika on pregnancies. Some evidence suggests infants exposed to Zika during pregnancy, who appear healthy at birth, could develop health problems later in life. But the range of possible health problems is still unknown. This is why protecting pregnant women is our top priority. The best way to avoid getting Zika is to protect yourself from mosquito bites. Wear long-sleeved shirts and long pants. Stay and sleep in places with air conditioning or that have screened windows and doors that keep mosquitoes outside. Use EPA-registered insect repellents with DEET, picaridin, IR 3535, oil of lemon eucalyptus, paramethanediol, or 2-undecanone. These repellents are safe for pregnant and breastfeeding women. Wear clothing and gear with permethrin or buy permethrin-treated items. Once a week, remove standing water from inside and outside your home. At this time, there is no vaccine or treatment for Zika.
As the virus moves into the U.S., we still have to take a good travel history on the patient. We also have to be concerned that any other virus or mosquito-borne illness could be infecting the individual. As far as Zika virus goes itself, I do think that the symptoms of fever, rash, joint pains, conjunctivitis still hold true. They're very vague symptoms, but with that and you're in the proper location, warm weather, with mosquitoes, it's something to consider in terms of testing. There is no commercially available Zika test. However, if we feel that a patient comes back from an endemic
Zika virus can be transmitted through mosquito bites or sexual contact. Infected babies may suffer from microcephaly, affecting their growth and intellectual ability and requiring lifelong care. The virus can also cause neurological complications, such as paralysis or respiratory difficulties. Death may occur in severe cases. Everyone should take precautions to protect themselves from getting Zika virus.
The virus was also the focus of CCTV's World Inside. Among the guests, Dr. Bernhard Schwarzlander. He's the World Health Organization's representative in China. The doctor explained how people in the Americas and other affected areas could avoid infection.
One, we know how to control mosquito populations, and there's many things that can be done, and we have to do more effectively, and we have to work together to make sure that we push back the mosquitoes itself. The second, of course, is, and it has been mentioned already, it's very important that we make sure that everybody who may be living or exposed to the mosquitoes has the knowledge and has the means to protect themselves. And there's very simple matters which are very effective. I mean, just wear long sleeves, for example, so the mosquitoes don't get to the skin. Have access to effective repellents that actually keep the mosquitoes away, and with the mosquitoes also the virus. So these are the things that we have to focus on now, and we can do a lot, especially also in places like China, where we have seen regular outbreaks with dengue virus, which is transmitted through the same mosquitoes, and make sure that we push back the mosquitoes, and we have the population with the knowledge and the means to protect themselves.